大家好，欢迎来到肾脏基金会的 Plug In 节目。在今天的节目中，我们很荣幸地请到了苏珊·塞缪尔医生，一位卡尔加里的世界级获奖研究员。塞缪尔医生是一名儿科肾病学家和临床科学家，以其对儿科肾病患者的卓越贡献而闻名。他最近被授予了加拿大1级研究主席的称号，也是肾脏基金会新研究员奖的获得者。塞缪尔医生会在节目中和我们聊聊他致力于改善儿童和青少年慢性病护理的工作和研究。2月是心脏和中风意识月，在你知道吗环节，我们将告诉你肾脏疾病和心脏病之间的联系。不要走开，我们将为您带来更多精彩内容。
Thank you, Dr. Samuel, for being with us today and taking the time to talk a little bit about research and your interest in nephrology and how you got into the field in the first place.
Thanks, Jill, and it's great to be here, and I'm just so delighted to share my story, and hopefully it'll inspire other physicians and trainees like myself and patients out there and the general community.
I think the first question I'd like to ask is, what attracted you to the field of nephrology, specifically pediatrics?
So I've always wanted to work with children. I believe that working for the health and well-being of children is an investment for the future. So I was a very committed pediatrician, and I was training at Sick Kids as a pediatric resident, and it was time to choose a specialty. And I knew that I wanted to be an academic physician. I wanted to contribute to research, education, and to advance care. So I reflected on all the different specialties that were available that one could apply to, and then I realized that I should just do my family business. And the reason why I say that is because we are a family who always valued academics and research, and my family has a history of polycystic kidney disease. My grandpa died before the time of dialysis, and my dad also has the same condition, and he is a scientist, and now because of his kidney disease he has lost his career in science, but he has had a great impact on my own thinking and my career. And so for our family, mentoring me as a scientist was a way of carrying on our family's dream to contribute something back to humanity. And it's not just my father who said that to me. His own big brother, who had cysts but never had kidney failure, his last words to me were, be successful and serve humanity. So as a family, the knowledge of having an illness like kidney disease with no cure except a transplant urges each of us to do better through science, through medicine, to make a difference.
That's really powerful. What was it specifically about research that attracted you?
From a very young age, I was very committed to a very systematic and structured method of thought to advance health and to think about how we can do things better to make lives better for patients. So I was always committed to that. Even in my undergraduate days, I volunteered for the Cochrane collaboration. The Cochrane collaboration is an international consortium that reviews evidence and presents the best evidence for best therapies in all types of medical problems. So I was a volunteer reviewer for the Cochrane collaboration when I was an undergraduate student, and it impressed upon me the need to have proper training in conducting clinical studies, being able to synthesize evidence, and to provide the best advice for frontline physicians as to what is the best medical therapy for a certain health problem. So with that, I came into medical school, and throughout medical school, I was always very attracted to being an academic physician. I didn't really know what that meant, but throughout residency, it became apparent that research and science is how medicine advances, how we advance patient care. So I wanted to be part of that whole process. And I did a master's in clinical epidemiology, got the toolkit to design clinical studies and to evaluate evidence, make guidelines for treatment. And then I came to Calgary as a new pediatric nephrologist, just graduated from Sick Kids Pediatrics and Nephrology. I came to my interview and I said, I really would like to do research. And the department head looked at me and said, yeah, I think I can make that happen. And so he gave me protected time to pursue research in my career. And then he also did something really remarkable, which is he said, if you're going to make it in research, you need a good mentor. And I'm going to introduce you to someone who is a good researcher and a great mentor. And he introduced me to Brenda Hemmelgarn. And that was the beginning of my career in research in kidney disease and research overall. And she had that incredible insight, patience, dedication, and commitment to me as a scholar to help me build up over all these years to become an independent investigator and a clinician scientist. So just that interaction with Brenda, I was able to groom myself into a clinician scientist, a clinician who's dedicated to research and innovation. So mentorship is really, really important in a research career.
Absolutely. And it sounds like through personal, professional, through your academics, there's been many significant mentors for you. Stay with us. Dr. Samuel will be back with us shortly.
您是否知道心脏疾病和肾脏疾病之间存在的关系呢？您的心脏和肾脏是您体内两个独立的重要器官，它们共同努力来维护您的健康。当一个出现问题时，另一个也会受到影响。当您患有心脏病时，心脏是无法正确地完成泵血的过程，这时心脏内就充满了血液。这些血液会堵塞与肾脏相连的主静脉，而形成压力，导致肾脏供氧不足，最终就会产生肾脏疾病。受损的肾脏会释放过多的酶，这些被称为肾素的酶会影响血液，这就会增加心脏病、充血性心力衰竭和中风的风险。实际上，肾脏疾病和心脏疾病具有许多相同的风险，例如糖尿病和高血压。因此，切记患有肾脏疾病会直接增加您患心脏病的机会。当然，患有心脏病也会直接增加您患肾脏疾病的几率。希望我们分享的信息对您与您的健康有所帮助。
Dr. Samuel, can you tell me a little bit about your family's reaction when you chose nephrology and then when you chose to become a researcher in order to, as you said, fight kidney disease? What's their reaction been?
I think they were not surprised that I chose nephrology. I think they were happy, but I think vividly, like when you live with someone with kidney disease day in, day out, and some of the mental imageries that I can think of are the fatigue, the chronic kidney disease patient, the patient on dialysis wiped out, not being able to get up for 6 hours a day, the smell of uremia in your bathroom. Like that's not something that's ever talked about in the community, in clinicians' language. But these are things that families have to live with. And then of course, being attentive to food and a lot of activities. When you're on dialysis, you're not able to do that because you can't travel or go places. And then the change that a transplant brings you and the hope, but then the despair when you find out that maybe some things are not working or panicking about a complication. Then only can really understand what is it about that disease you want to make a difference in, what is important to the patients. So I said, I know something about this and I'm going to apply myself. And that drives me every day. And that's why I'm here.
You have a level of empathy that very few physicians and researchers have. You're bringing something to the table that really and truly other researchers and physicians don't understand. Can you tell me a little bit more about the impact of knowing that there is PKD in your family has had on you?
Yeah, this is something I've reflected on quite a bit as I grow older. The impact of knowing that there's a hereditary kidney disease in your family, and that I have a 50% chance of inheriting it. And the joy of knowing that I'm middle-aged now and I don't have it, but yet feeling the sorrow of maybe other family members who may have inherited it. So that's something that's defined my young adulthood for sure. And just growing up knowing that my parents have a sense of sorrow as well, that there is a genetic disease in the family that they will pass on if they have children. And that's a sentiment that's universal to families with polycystic kidney disease, and individuals have to make decisions as to whether to have children or not. And if they do have children, to live knowledge that at some point in the future that they would have to go through testing to determine whether the disease has manifest in their child. So those are emotions that as families we go through. But it's also brought our family quite close together, the common cause of fighting a disease and being an advocate for my dad. I don't think people realize the importance of research and innovation and science until you see it play out in your family over a series of generations. About 50 years ago, my grandpa was diagnosed with polycystic kidney disease. At that time, there was minimal diagnostic methods to tell you exactly what type of kidney disease it was, nor was there any treatment. And he died fairly young, with 7 children, left destitute. And one of those children was my father. And the information didn't pass on to him that he could potentially have inherited a kidney disease because the diagnostic tools were not available. And he discovered later in life that this is an inherited kidney disease with advances in care and knowledge and so on. My dad now is 72. He's lived a wonderful life on dialysis and has a wonderful kidney transplant given to him by a donor that we'll never know, but that kidney works. 14 years later, it's still going really strong, and we are grateful to that donor and his or her family who made that gift. But what research has done for our family is given my dad that extra 22 years that he wouldn't have had if we did not have advances in dialysis and transplantation, in life-sustaining care. And this all came through research and innovation over the last 50 to 70 years. So it gave me a chance to witness the power of investment in science over 2 or 3 generations. My dad lost his dad when he was 8. I have not lost my dad yet. And that's the miracle of science.
That's a perfect way to tell us the importance of research and explain it from a very personal perspective. And again, thank you for doing that. This has been really interesting, and I'd like to talk to you a little bit more about the influences that the Kidney Foundation has had on your career. Are you able to stay a little longer?
Yes, definitely.
We have more of our interview with Dr. Samuel coming up shortly, so don't go anywhere.
Can you imagine losing most of something without realizing it? Over time, kidney disease can destroy up to 80% of kidney function before you notice any symptoms. Talk to your family doctor to see if you're at risk and need to be screened. It could save your life.
Dr. Samuel, you've had a connection to the Kidney Foundation of Canada throughout your career. Can you tell us a little bit about how the Kidney Foundation has impacted your career?
The Kidney Foundation has been influential in my career. I received 2 very significant awards from the Kidney Foundation. One was an operating grant and one was a salary award. So when I started out as a researcher here at the University of Calgary, I applied for operating grant funds to study how transition from pediatric to adult care impacts youth who have received a kidney transplant. And that work was funded by the Kidney Foundation through the General Operating Grant Scheme. And what we found was that there was a high incidence of kidney transplant graft failure in the immediate period post-transfer to adult care. That publication has led to improving care around the transition period, in particular implementation of some young adult transplant clinics across the country, including here in Calgary. So I believe the Kidney Foundation had a great impact in influencing the care of youth with kidney transplants and youth with kidney disease in general. And the other more influential award that I got from the Kidney Foundation, for which I'm really grateful, is a salary award which recognized my position as a clinician scientist. So in our career, we are encouraged to receive external salary awards to maintain our position as a clinician scientist so that we can protect our time to do more research and less clinical work. So that CRESCENT award that I got was the most influential award I got in my career because it established my professional role as a clinician scientist. In fact, the Kidney Foundation partnered with the Canadian Child Health Clinician Scientist Program, who also had a similar award, and I was able to receive both awards. And I'm very proud to say that I was trained as a clinician scientist through both the kidney community as well as the child health community. And that has set up my career for success. So I'm very grateful to the Kidney Foundation for launching my career that way.
Life can be unpredictable. Anything from a flood, wildfire, earthquake, or even a pandemic may affect the availability of dialysis services. Being prepared can save your life. Don't wait until an emergency happens. Take the steps to be ready now. Have your copy of the Emergency Preparedness Information for Dialysis Patients booklet on hand and keep it updated with your personal information. Keep a list of your current medications with you and always have at least 3 days supply on hand. Make an emergency pack. It should last 72 hours. Carry a BC Renal Emergency Wallet card with you. After a disaster strikes, follow these rules to stay safe. Stay at home if you can. If you are hurt, go to a hospital. Begin the emergency renal diet. Wait for instructions. Keep radio, TV, and phone on if possible. Dialysis patients should be prepared to have dialysis day or night or at another dialysis unit. Need help? Go to bcrenal.ca, Health Info, Emergency Preparedness to get started. Download important documents you will need in the event of a disaster. Get prepared. It can save your life.
Dr. Samuel, I wonder if you can tell me a little bit about what the focus of your particular chair is.
So my research program will focus on nephrotic syndrome. Nephrotic syndrome is a common childhood condition. This is where children leak protein from blood into the urine. No one knows what causes it. The usual child who presents with the disease is between 2 and 6 years of age. There are thousands of these families out there who have children with nephrotic syndrome. And the reason why this is so important, because protein leaking from blood into the urine is a common factor among many immune-mediated kidney diseases. We treat nephrotic syndrome with prednisone. However, only 90% of children respond to prednisone and the 10% don't. And the ones that don't have a much more severe prognosis and risk of kidney failure. The problem with this condition is that it is a relapsing remitting disease. And those relapses, if treated with multiple courses of prednisone, can have significant side effects in children. So growth retardation, behavioral disturbances, sleep disturbances, risk for infection, etc. So this is not an ideal drug. That's why we need new medicines to treat the disease. There are some new drugs, some generic immunosuppressant, but none are specific for nephrotic syndrome. So it's really a trial and error medicine that we go through a series of medications to try and get the disease under control. So I'm really committed to finding better treatments for nephrotic syndrome. So what we're trying to do with our research chair program and our research program in general is we're studying children with this condition across Canada. We want to know how they present with the disease, what their disease course is like, what treatments they receive, which drugs work best, and in which patients. This study also gives us an opportunity to collect blood samples and study the immune cells of children in relapse and remission of nephrotic syndrome. But that in itself won't advance care. We need to understand the fundamental biological mechanisms by which the disease happens and design targeted treatments to mitigate those disease-causing processes or to cure. And so myself as a researcher cannot do that alone. So together with my colleagues at McGill University, we're collecting blood samples here in Calgary and across the country to basically look at the immune profile of children in relapse and in remission before and after treatment of certain drugs, and what role the immune system has in turning off and on the protein leak in the urine, and what impact the common drugs that we have in hand have on the immune cells. So all of this is leading to a more precise understanding of what causes nephrotic syndrome and what drugs work to treat nephrotic syndrome and how they do it. We don't have the perfect drug yet, but the information gained from these studies will help us towards designing those better drugs with fewer side effects. And why this is so important is because it may give us clues as to how protein leaks from blood into the urine. So once we understand how this process can be halted and how the various drugs that are used to treat nephrotic syndrome influences disease course, will be useful to help us understand how to design better treatments. And that's why we're chasing this particular condition. And that's why I think that this chair and the work that we're doing around this particular condition will make a difference, not just for this one condition, but for many other related immune, glomerular, or kidney diseases.
Thanks to all the car donations made to the Kidney Car program, the Kidney Foundation of Canada can help all these people with kidney disease. Those donations are instrumental in providing them with care and invaluable support. When you give your car to the Kidney Car program, it will be towed for free and recycled or resold. You'll also receive a tax receipt of at least $300. To continue to improve the quality of life of thousands of patients, we need your car today.
Welcome back to our interview with Dr. Susan Samuel. The scope of this particular research grant is really vast because you are looking to make a transformational change for children and families. And it's something that you have to start right at the bottom, and it's going to take a whole heap of people over a long period of time. But when that comes to fruition, it will lead to this transformational change.
You've just nailed it. I think that is it, is that research takes time, change takes time. You need dedicated people working on very focused areas to make a large impact, a transformative impact. So the work we're doing in childhood nephrotic syndrome is going to make an impact. But that work starts with research that we're doing now. And this is a generation of work. It's not going to happen in my short career as a researcher. What I want to do is to put the foundation so that someone coming behind me can put the next block on and the next block. And eventually, in the 50 years of my family's story, how one could extend one's life for more than 20 some years just with research and innovation, we will see a difference in how we treat kidney disease. We will understand how to turn off protein leak in the urine, but that takes patience and it takes dedication. And that's what research chairs like myself across the country are working on.
And it also takes funds. It also takes support of research programs. And it just reminds me that the Kidney Foundation receives support and donations. And when we talk about funding research, this really makes it clear to me why funding research is so important.
Yeah, I think the Kidney Foundation donors need to understand that donor dollars go to real people who care about patients and who want to make a difference. And these dollars are given to individuals like myself who will use it to carry out a research project and to create new knowledge and translate that into the clinical realm and provide the support the patients need. And another aspect of the donation dollars will go to support salary of individuals like myself so that we are not reliant on clinical work to continue to support ourselves. We can protect our time, and that time is critically needed to conduct the best science in order to move the field forward. And that's what those salary awards are for. It comes to individuals like myself, and we dedicate our career for the advancement of kidney research.
So you're not having to make decisions about your clinical time and, working after hours and balancing family and all of your other priorities. The research grants really give you the time to focus on that objective and do it really well.
That's absolutely correct, Jill. That is exactly what it is. It's giving the time and the space that a clinician scientist needs to produce good science. If we are going to improve health and well-being, knowledge has to increase. And we have to invest to create knowledge. And it's the donors like the Kidney Foundation donors that make a difference.
Well, thank you for taking the time with us today. I really appreciated speaking with you and hearing all about your career and research and all the great work that you're doing.
Thanks so much. It's been my pleasure. Thanks for having me, Jill.
Can't believe everything that you're doing. I mean,
Yeah, no.
I feel guilty for saying I'm tired.
There's a get real moment of being a mother of three and being a researcher and a doctor. We can have lots of bloopers about that, but I don't
This has been really interesting, Dr. Dr. Sandals, not Dr. Sandals. We have more of our interview with Dr. Samuel coming up shortly. I was like, was it shortly or was it not? I'll do it again.